Hey everybody, this is Dr. Daniel Choi here at North Texas Dental Surgery, Wisdom Teeth, and Denture Implant Center.
I'm Dr. Tyson Koo.
All right, guys, I've made all-on-4 videos for a few years now, and I'm going to say that this is probably going to be the most important all-on-4 video that I have made to date. So I would highly recommend that you guys, if you're interested in doing all-on-4 or you're already going through the all-on-4 process, if you want to know everything you can about it, this is probably going to be one of the most important videos I'm going to put out. So I would highly recommend you guys pay attention and maybe even come back to this. Also, FYI, we've made a few other videos talking about many all-on-4 concepts. I'm going to have them linked below, so please check those out later. All right, let's get right into it. All right, so basically these are all-on-4 basics, talking about some of the basic principles about all-on-4 that I think it's really important that you guys understand. Because what a lot of times when people, they see advertisements or they see photos like, oh, this patient went from here to here, and this was a case we did like 2 weeks ago. This is 48 hours later, right?
Yes.
This is in his temporaries, but patient sees something like this and they're like, oh my God, I can do that with my teeth. Let's do it. But the whole purpose that we're making these videos is that there's a lot of pitfalls that can happen, right?
Yes.
So the whole aim of this series of all-on-4 videos that we're making is that we want to let you be aware of all the things that, as beautiful and great as all-on-4 can be, there are a lot of things that, even though all-on-4 is a 25-year-old procedure, things that can go wrong. Last week alone, we saw 3 patients come into our practice that needed help, that had invested a lot of money in all-on-4, and believe this or not, one of those patients spent $106,000, and she actually, we helped her out, and she actually left a message while we were in surgery earlier today that she wanted to give us a gift because she was so happy with the work that our prosthodontist was able to do for her. And we'll make another video about that one day because she had some issues with her speech and what we were able to do for her. But again, main point being, a lot of these things can be prevented if you can become more informed about some basic things going on with all-on-4 that a lot of patients don't know about, right? Again, people just see transformation from here to here, not knowing a lot of the details and the minutia of what can go wrong while trying to achieve this. So next thing is, all-on-4, what that really is although we see just this inside the mouth, the prosthesis, and to give you another quick example, this is the zirconia prosthesis in someone's mouth. Well, not in someone's mouth, but what would go inside someone's mouth. But, what's supporting it are the dental implants. And what you also don't see are the multi-unit abutments that go on top of the dental implants, because the dental implants are buried in your bone. There's got to be a connector piece protruding through your gums, which is what we call the multi-unit abutment, which then allows the prosthesis to then screw into this, right? So let's look at another animation about this. So imagine surgery day. We're going to go ahead and we're going to place these dental implants. These multi-unit abutments then get screwed in to the top of the dental implant, and then the prosthesis, the fake gums and teeth, then gets screwed in to the top of the multi-unit abutment. And to just, to make this really clear, again, the dental implants go in with the multi-unit abutments protruding through your gums to allow this prosthesis to then be anchored in with these prosthetic screws into the top of the multi-unit abutments. So just to reiterate, the components to the all-on-4, again, the implants buried in your bone, the multi-unit abutments that are attached to the top of the dental implants, protruding through your gums, and is the base upon which the prosthesis is screwed in to the multi-unit abutments. Okay, so that's how an all-on-4 works. And the reason why we tell you this is that it is a very key point to understand that for all these components affect each other. They're all interrelated. So the implants affect the multi-unit abutments, which also affect the prosthesis. So I tell patients, if we were to draw like this little triangle, the 3 words implants, multi-unit abutments, and prosthesis, they would have arrows all heading in both different directions of how they all affect each other. They're all interrelated. So it's a very key important point that you just don't go and do an all-on-4 procedure and say, hey, this guy's a great surgeon. He's going to do great implants for us. Well, is he going to be able to do a good job for your prosthesis? Is he going to be doing a good job for your multi-unit abutment selection? Are we dealing with somebody who maybe is good on the other aspect? Hey, it's good at doing the prosthesis, but maybe not so experienced in doing the surgeries. So again, it's a very key point to understand that it's very important to get all these bases covered. That's why it's very important to be working with a really good team at an all-on-4 implant center. Now, let's go to the next point. So if your implants aren't placed well to last for the long run, it will affect your abutments and teeth, meaning your prosthesis. If your abutments aren't well selected and placed well, it will affect your teeth, your prosthesis. If your teeth and bite, which is your prosthesis, aren't designed well, it can affect your abutments and implants. So again, to reiterate, all these things, your implants, your abutments, and your prosthesis all affect each other.
And I want to add a component to this. The question is, how well does a patient take care of their prosthesis? That will really determine the long-term treatment outcome.
Right.
Yeah.
So, well, we always tell people, you know, and there's that, you know, and we're going to create more videos talking about it. Like there's zirconia prosthesis. One of the biggest, beautiful thing about it is you can drink all the Mountain Dew you want. Right? You ain't going to get a cavity on that. You're not going to get a cavity on a multi-unit abutment or an implant. You still got to brush your teeth, though.
Yeah, but you got to keep the space between the prosthesis and the gums as clean as possible.
Yes, so that's how you're going to use water pick and floss and all those things, right? The floss threaders and all that stuff. So we will definitely even talk more about that topic in the future. All right, so let's continue with this. So to reiterate with the implants, I want to tell patients also that I did create a Dental Implants 101 series talking about many topics about dental implants in a coordinated fashion, from the bird's eye view to the more minutia, talking about all the great things about dental implants. And we know that dental implants are a great solution. I don't feel like there needs to be like any awareness directed towards dental implants. But again, the whole goal of this is to say, hey, what can go wrong with dental implants, right? Don't tell me about all the amazing things. I want to know what can go wrong. I've been doing this for 13 years.
Yeah.
You know, now like 45 years of age, you know, don't tell me about this great new product. How long has it been tested? What can go wrong with it, right? Yeah. So the whole purpose of the Dental Implant 101 series videos, and we'll have them linked below, is to talk from, again, the very bird's eye view to more detailed things about what's actually going on with dental implants. So let's continue here. So dental implants, they're titanium screws that come in many shapes, widths, and lengths. They serve as posts to support your prosthesis. So I want people to think of, like, for example, a fence post, right? So you want to put a fence post as deep in the ground as possible to support the rest of your fence. Let's talk about a mailbox post. You're going to want to bury that mailbox post as deep in the ground to support your mailbox. So similarly, what we're doing here is, if we're going to support this prosthesis, we need to bury some dental implants as deep into your bone as possible. Another thing, so I gave an example earlier in other videos talking about, let's talk about fence posts. A fence post, we got to be prepared. We live in Dallas Fort Worth, where we get tornadoes, we get some high powered winds. So we need to anticipate, if I'm a fence builder, contractor, that I'm going to bury some posts as deep in the ground as possible to support our fence so that it doesn't fly away should strong winds come. Similarly, when we're dealing with patients, one of the biggest variable forces that can happen is patients can have very different chewing forces.
Correct.
Right? So we can have one guy who's 40 years old, another guy who's also 40 years old. They have very different chewing forces because these muscles of mastication very different on some people. Some people, 80% of the population has parafunctional habits, meaning clenching or grinding. I myself am a clencher. Do you clench or grind?
Yeah, especially when I work out.
Okay, got it. Right. So everybody's different in regards to, like, their biting forces. And with that, I've seen 80-year-old grandmothers who do all-on-4 and they're clenching and grinding like crazy. That clenching and grinding doesn't disappear whenever they do all-on-4. So if you are a person that clenches and grinds, we need to make sure that we're going to place dental implants that are going to be long enough and wide enough to be able to support all the forces that are being generated on your teeth, on your prosthesis, so that your dental implant, so your prosthesis is not going to be affected and your dental implants are not going to fail. Because what patients don't understand is that if your dental implants aren't big and long enough to support all these forces that are coming down on your teeth, your dental implants can actually overload and fail.
Yes, and for those patients, sometimes we may have to place more implants than we normally do.
Right. So what we'd have to do is we over-engineer.
Yes.
Because it is really unpredictable when we're doing all-on-4 cases. I mean, we are not their general dentist following them for the last 30 years of their life. We don't know what their dental history is, essentially, or how prone they are to breaking teeth like that. And a lot of times, patients don't even know themselves either, right? Yeah. I graduated dental school and I was in residency before I ever realized I'm a clencher. Yeah. So similarly, many people are like in their 50s and 60s and would swear that they're not clenching and grinding, but we see the wear patterns within their mouth, and you could see that sometimes, right? In extreme cases. So let's go to the next point. So yeah, just to reiterate, we want to place as big of an implant in your jaw as possible. And also, when we place your dental implants, we want to wait about 3 to 4 months for your implants to fuse or osseointegrate with your bone. This is exactly why during the healing process, we want you to have a soft diet, right? We don't want you chewing like, beef jerky or biting into carrots or corn on the cob right off the bat. You got to go through that healing process. And we want to tell patients also during that healing process, when we deal with an implant 3 to 4 months after osseointegration, what do we say? It's like it's concreted in, it's like cemented in.
Yeah.
It's very, very strong.
Rock solid.
Rock solid. But during that initial phase, it's soft, right? We just placed it in the bone, and we're just waiting for time to, healing to take its course. So that's what happens with osseointegration. So this is a very important point we want to talk about again, the multi-unit abutment. That's the little connector piece in the middle. The connector is placed on top of the dental implants to hold and support the prosthesis, right? So this is the intermediate part right here in the middle that, again, you can't see. The implants are buried in the bone. This is connected to the top of the implant, protruding through your gums, so that this prosthesis can then anchor into the multi-unit abutment. All right, so they come in many different angles: 0 degrees, 17 degrees, 30 degrees, 45 degrees. And so let's talk about this real quick, because this is a very fundamental aspect that patients, we were just talking earlier about this. Hey, you know what? I want to let you guys know this is our 3rd attempt filming this video, okay? This software has crashed twice, and it's 7:50 at night and I'm tired. So, but we want to reiterate what we said earlier in this video, like in earlier, videos. Multi-unit abutment selection is probably one of the key components of doing a good all-on-4.
Yeah, I find it to be the most challenging aspect of all-on-4 procedures, at least for myself.
Right.
Yeah.
Me too. And we've done hundreds, if not thousands, of all-on-4s.
Yeah.
So, granted, we're pretty good at selecting multi-unit abutments during the surgery, but sometimes, even after the surgery, after the healing period, we need to change out an abutment to a better angle or a different angulation, or what we call timing, to make sure that your access holes and therefore prosthetic bulk is minimized. Yes. What am I getting at? I know this is really confusing, but what I'm really saying is that for your prosthesis to be as lifelike as possible and as natural as possible, to give you the most realistic bite without all the added bulk and impediments to speech, multi-unit abutment is going to be the most important thing. I'm going to pound my fist into the table here. It's the most important thing that you can do when doing an all-on-4. Now, how many people have you talked to about all-on-4 that have talked about that before? In your research for all-on-4, do you know anything about multi-unit abutments? No, nobody ever talks about it. In my previous videos for all-on-4 that I've put out for the last few years, have I talked that much about multi-unit abutment? No, because I was talking more superficially about little things and trying to get into minutia, but I missed one key important point. It's the multi-unit abutment. So that's what I really wanted to stress in these videos. And to help you guys to understand this, let's talk about something real quick. So you also mentioned that you had a history. You worked at an all-on-4 center. You worked at an overdenture, snap-on denture center, right?
Yes.
So tell us about your experience there.
Okay, so for the snap-on dentures or overdentures to work properly, the clinician has to place implants in a parallel fashion. It's relatively easy to do in the lower jaw, but I find it very, very difficult to do it in the upper jaw because of the anatomy.
Right. So everybody's jawbone, sinuses, how much bone they've lost over the years, if they've lost teeth. Also, I talked about it in my Dental Implant 101 series, link below, like biotypes. People have thicker bone and gums. Some people have thin bone and gums. I did an all-on-4 yesterday on somebody that had thick bones, thin gums. It varies tremendously, right?
Yes.
And so when we do these implants, the reason why you're saying that we have to place them parallel is that when we're putting your snap-on denture on, off, because that's what you're doing. You're able to take it off and snap it in.
Yes.
Your implants have to be parallel, because if they're all going at different angles, then how are you going to get that denture, that snap-on denture to go on? It's not. So I'll give you a quick example. So this is actually my 3rd time talking about it right now in the previous takes. So we have an IKEA right here. You go to IKEA, you buy a table, a prefab table that you put the legs up, then you got the underside of the table that you snap into the legs, right? But if your legs, one's going here, one's going here, one's here, and one's there, how are you going to put the tabletop on top of that? It's not going to go on, right? So they have to be very parallel with each other. And then, therefore, we can make sure that that tabletop goes in and snaps in place. Similar concept with the snap-on denture. If your implants are very parallel, snaps on nice and easily. But what happens with everybody's jawbone, because everyone's anatomy is different, how much it flares out or comes in or whatever, how much bone loss you've had over the years, doing a snap-on denture becomes very challenging. We've done tons of all-on-4s and snap-on dentures, but you agree with me in this, that you get more stressed out doing a snap-on denture than an all-on-4.
Absolutely.
Yeah.
And the patients end up coming to us a lot for repairs and maintenance.
Right. But even during the surgery I'm talking about, when you're trying to get the implants as parallel as possible, it's stressful.
Yeah.
Because we're dealing with your anatomy, which is not ideal, trying to get these implants as parallel as possible. So other things that we have to do to try to get them as parallel as possible is we then do extra bone grafting. We can do sinus lifting. All these things cost more money.
Yes.
You're going to have a longer time period healing. And with all the added money, you might even be at the all-on-4 area now, right? So you're not really saving anything.
Yeah.
So there's absolutely no benefit to doing the snap-on denture at that point. Long story short, before I talk my ear, your ear off here, is that it's those are the limitations for an all-on-4. Now, I mean for the snap-on denture, the all-on-4 doesn't deal with that because you can place those implants not at almost any angle, but really almost at any angle.
Yeah.
You have a lot of variability. You can avoid sinuses. You can deal with thin bone. You can change the angulations of all your implants and still have them come out at the same angulation due to the multi-unit abutment, right? So I said earlier that the multi-unit abutment comes in 0 degrees, 30 degrees, 17 degrees. It can compensate for angle changes with these connector pieces. So to help illustrate, and I gave this example earlier, imagine I go to IKEA again, my one leg's here, 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 here. I call up IKEA and I say, hey, this table's all screwed up. You need to I need to get a new table. And they're like, no. Before you do that, we had issues with this, but we corrected it. We have these little connector pieces that you put on top of it. It's like 2 inches thick. You put it on top, and it's actually going to course correct for the angulations of the legs. Okay, so this angle leg that was like this, you just snap on this little connector piece like this, and then on this leg that was like this, you just put on this little connector piece like this, compensating for all the angles. So now all your legs are all parallel with each other. Put on my little tabletop, boom, it fits. Okay, similar concept. Your dental implant might be here, 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 and here. Course correct with a proper multi-unit abutment to change for the angulations. And then, boom, we now have something that can draw in and out, that allows this prosthesis to go in so that I can then permanently screw it into your mouth. That is the beauty of all-on-4. The beauty of all-on-4. The reason why, we made earlier videos about it. Again, it's linked below. But what we talked about, one of the advantages of all-on-4 is cost. The reason why we can really save on cost is we don't have to go through all those extra sinus lifting procedures, the bone grafting, guided bone regeneration procedures that add more expense, stress the heck out of us during these surgeries. But we can avoid all that by placing the implants at the angles that they need to be within reason. The sinuses, and we'll talk about that in a little bit. But within reason, we can do all these course corrections with the angulations of the implants, placement of the implants, and course correcting with the multi-unit abutment. That is the beauty of the multi-unit abutment, which allows the all-on-4 to be an extremely flexible procedure. The multi-unit abutment, again, how many videos have you seen that they talk about the multi-unit abutment, right? But as great as the multi-unit abutment is, the problem with the multi-unit abutment is proper selection of the multi-unit abutment can be challenging sometimes, right?
Mm-hmm.
So we just said during the surgery, as experienced in how many all-on-4s that we do, we're pretty dang good at nailing which multi-unit abutment. But sometimes we see that the proper multi-unit abutment wasn't selected. So later on during the process of, before we get you in your final prosthesis, we do have to make sure that we then change out to a proper multi-unit abutment. Actually, on that patient today who came in, she's almost finished. She's heading towards her final zirconia prosthesis. She's a CRNA. She's a nurse anesthetist. And she had, very few teeth, and she wanted to give herself a beautiful smile. We were able to do that for her, but she did have a little bit more prosthetic bulk than we wanted, right? So what we wanted to do for her was change out some of those multi-unit abutments for her. So she actually came in this afternoon. And so this next set of teeth that we make, where we finalize her towards her zirconia, she's gonna love them. I'm very confident about that. So those multi-unit abutments make a dramatic change on the outcome of your all-on-4. It's very important that you understand that point. Whether, again, you're heading towards all-on-4, you've been, you're considering, or you're actually in the process. Okay, so next topic is the prosthesis. So again, the definition of the prosthesis is it's an imitation body part. In this case, it's fake teeth and gums. Again, this is what a prosthesis looks like. This is actually a prosthesis that we designed for a patient. And the role of the prosthesis is to make sure you have good aesthetics, bite, and speech. So what good is having beautiful teeth if you can't speak properly, or if you can't chew properly, or what's the point of having a great bite and speech, but you hate the aesthetics, right? So those are, the combination of things that we need to balance whenever we're doing our prosthesis for you. So our prosthodontist does a phenomenal job and makes our patients very happy at doing that. So let's jump on to the next topic here. So implants. So we mentioned earlier we want to place as big of an implant as possible, but within reason. Okay, so now what are those reasons? So we don't want to place implants into any nerves, arteries, sinuses, etc. This could cause permanent numbness, life-threatening bleeding during surgery, etc. We see this all, right? So like I was giving an example. I had a filling done 6 months ago. I had they numbed me up, and like for a few hours when I was even drinking water and like bringing my cup to my like lip to drink, it felt like I didn't have a lip there.
Were you drooling?
Yeah. Well, you don't want to like
Yeah.
you don't want to feel like that for the rest of your life. So that's why it's really
Correct.
important that we don't place dental implants in your nerves. And
Yes.
also during surgeries when we some of the bleeds that we deal with, and so it's really good to know your anatomy, and there's certain areas that you want to avoid. You don't want to be placing implants in certain areas, right? And also sinuses. When we're placing dental implants, we want to avoid placing dental implants in your sinuses, right? Not because there's necessarily anything wrong with placing an implant in your sinus. It's just that you're not getting any support. And we're going to talk about that in a second here. So for upper jaw, what we call maxillary, all on four, the sinuses are one of the most important determinants of your all on four surgery complexity. Now, if you're going to do a lower jaw all on four, so mandibular all on four, the inferior alveolar nerve is a major determinant of your all on four complexity. So sinuses, what are they? So, before I went to dental school, and you said the same thing, you didn't know what sinuses were. I didn't know what sinuses are. You hear about sinuses, you see them commercials, they talk about sinuses, sinus pressure, you're flying or whatever, allergies. Sinuses, long story short, we have sinuses or empty air cavities within a few of our jaw bones within our head. The ones that we're worried about are your maxillary sinuses. Your maxillary sinuses are just air-filled cavities that have a little connection through your nose. That's why you can sense pressure changes within your maxillary sinuses. But the deal is that why we're worried about it is that with your sinus being an air-filled cavity, if we're placing dental implants up in your jawbone and 75-80% of your dental implant is hanging out in air, while only 20%, 25% of your dental implants hanging out in bone, let me give you a quick analogy. If we were to buy a $10,000 TV or have a priceless painting and we were to mount it on the wall, and manufacturer's instructions, it comes with screws and says, hey, put these screws into the wall 2 inches, the whole depth of the screw. And then we screw it in and our drywall is only half an inch thick. I mean, we're not getting enough support. Would you hang your $10,000 TV or your priceless art on the wall? No, nobody would do that. You're going to wake up the next morning and it's going to be on the floor.
Yeah.
So similarly, when we're doing dental implants, what we need to do is we need to make sure that those dental implants are completely buried within bone, right? Going back, we said a few minutes earlier that we want to bury as much of your posts in the ground, whether it's a fence post, mailbox post. Similarly, the same thing with the dental implant. It needs to be buried as much as the bone as possible. So going back, when we're looking at this patient here has sinuses that are normal sized, right? We can stay out of the sinuses and place our implants where we need to be. We'll angle them forward. This patient has got big sinuses. That means we can't come back as far to place dental implants. Well, that's a problem because when he's chewing on his back teeth here, that's going to be an issue because we might create a cantilever, right? So the problem with sinuses is that the majority, about 60% of patients have large sinuses. That could affect how far back we can place your implants. And if we can't get far back enough, we will create what we call an excessive cantilever. So Dr. Koot, please tell us about cantilevers.
Yeah, so I want to show you this prosthesis. I don't know if you can see the holes. So this is where the last implants are, these two holes, right? So any part of the prosthesis that's behind these two implants are considered cantilevers. So anything that's unsupported by the implant. So these parts are more prone to fracture, and the longer the cantilever, the more stress is going to be put on the most posterior implants.
Right. Mm-hmm. So cantilever is not like a dental topic. We mentioned in the other video, like I didn't know what the hell a cantilever was before, right? You didn't either. So it's an engineering thing. So with cantilevers, it's similar to I like to watch a lot of YouTube videos on TV. I mean on TV instead of TV now. I probably listen to 8 hours of YouTube or like podcasts and stuff like that, or
I can
watch
attest to that.
yeah during surgeries.
Yes.
Like that self growth. I'm a zealot for that. I love that stuff. But anyways, get a YouTube subscription, by the way. It definitely stays out on the commercials.
And
And
please like this video and share this with your friends.
yes, please do that too. But anyways, we are going to create a lot more content about All on Four. If you are interested, we want to give you as much in-depth information about that as possible. But going back to the cantilever, so I like to watch a lot of YouTube videos that talk about, I like looking at home videos, new homes and how they do these architectural things, and they're talking about a cantilever, right? So this patio is cantilever, this porch is this deck is cantilevered. Well, what does that mean? It means that there's a support here, and then this part's hanging off of it. It's not supported. This is what they call cantilever. Well, the problem is when you do this with teeth and you're chewing on your back teeth, and let's say my last dental implant here is here, and you're chewing back here, you're going to create a cantilever where now you're putting a lot of force here. What can happen is this can actually break off. Well, not typically with a zirconia prosthesis, but what can then also happen is you're going to if your last dental implant is here and you're putting a lot of force here, you can cause a lot of stress to be exerted on that dental implant and start having issues. And even for that implant, as crazy as it sounds, that implant can fail,
Yes.
right? This is why we need to worry about this concept. So let's talk a little bit more on this little photo that I have here. So I got these photos from these of these tables on the internet, and so this table, it has a major cantilever, right? Because the legs are up here, and although they're like splaying them out here, we're not getting support at the very end. If you and I were to stand on this table and jump up and down, up and down, up and down, simulating what it's like to bite up and down and putting chewing forces down, we are ultimately going to either maybe break this edge of the table, the wood, or more importantly, what can happen too is underneath these components, these bolts that are screwed into the underside could eventually loosen, fracture, these legs can break. There's just so many things that can happen over the long haul under repetitive motions that a patient's going to experience similarly when they're chewing up and down, up and down, up and down. Something that patients need to also understand is we don't chew like this. Those little Halloween toys where they're like chattering like this?
More like this in general.
Envelope of motion.
Yeah.
You're grinding. It's an envelope of motion.
And fun fact, I just learned this about 3 weeks ago at a course. Humans average close to 1 million chewing strokes per year.
Mm.
Yeah.
So, in our table example, if we're jumping up and down on that thing 1 million times, we're going to break that table.
Yeah.
So similarly, we have to over-engineer whenever we're doing your all-on-4, because we got people that are like, they openly admit they even had a drug habit. They turned their life around, and they're clean, but now their teeth are destroyed, and they're 27 years old. What do? Well, two options: you either go into a denture, or you do an all-on-4, right? So when we're designing something, we're trying to design something that's going to last average lifespan 80 years old. We're honestly designing something that's going to try to last 53 years. Now, can we promise that's going to happen? We don't know, but we're going to do our best to try to make that happen, right? And the way that you do that is by over-engineering, right? So just understanding that these key components of like how we need to plan your case here. So let's continue. So similarly on this example, there's no cantilever right here, right? So if you and I are jumping up and down on this part, way less likely to break this table, right? Or cause issues versus this. So let's talk about it in relation to teeth. So this is typically how we design all-on-4. Again, we can angle the implants to stay out of the sinuses, right? Because there's no support here. We don't want to place your dental implants in the air. So we're going to angle these implants to stay embedded in bone. And then also we're going to have this prosthesis. There's no cantilever here because look at your far back teeth. The molars that you're going to be chewing with are fully supported right underneath, right? Now, please don't criticize my little artwork here.
Yeah, by the way, we don't make teeth like these.
Yeah. I literally pulled these off the internet. I took one of my X-rays, I overlaid some implants on there, I pulled these teeth from out of nowhere, idea, and I stretched them.
I don't scare you off.
Yeah. But I'm just trying to make a quick example to illustrate this for you guys. But anyways, the next one here is another example, but here's a cantilever. This patient's sinuses are now saying, I can only get implants here, right?
Mhm.
Can't do them here because we don't have enough height of bone.
Yes.
And then look what we got. This molar here that chews with the lower molar here and the molar here, first molar occlusion,
Mhm.
we got a 3-tooth cantilever. We have a very large cantilever. What's going to happen?
Yeah.
Teeth can break off, right? Or what we said, we can have a multi-unit abutment issues with the prosthetics. I mean, with the multi-unit abutment screw having issues, prosthetic screw issues, excess stress being exerted on this implant. When you keep on jumping up and down here, this implant's going to experience more stress issues and therefore bone loss and potential implant failure issues.
Yeah. I think the situation would be slightly better if the patient was missing lower molars, and if we just cut off the cantilever portions, might be a little bit better. But you know, if the patient doesn't have premolars and molar teeth, it would be an aesthetic nightmare.
Yeah. Not only would it be an aesthetic nightmare, but the patient can't choose. So what's the whole point of doing the all-on-4 procedure, right? And funny story is that I actually had a patient who contacted me from Florida, and they had the all-on-4 procedure, and they only had teeth from canine to canine. So they were like, "What the hell happened?" you know. So I explained to him and I was like, "Hey, show me your X-rays." And he showed me his X-rays, and I could see his sinuses were huge. And I was like, "There's your problem, right?" So what you needed was remote anchorage solutions. You needed zygomatic implants. You needed pterygoid implants. You needed sinus lifting or whatever. These are all options, but they're options that needed to be investigated before even undergoing the surgery.
Yes.
So again, the reason why this video is important for you guys is you guys need to know, you need to see if you have large sinuses or not. That's one of the main things that you need to see when you go in for your consultation. Look at that x-ray and say, hey, wait a second, are those sinuses like big? Where's the most distal implant that we can get back there? Because I don't want to have a big cantilever. Because again, if I have a big cantilever, I'm going to be spending a lot of money for this. Wait, how long is my warranty? Wait, what's going to happen? God forbid, like this breaks on me.
Yeah.
We had a patient who came in recently that actually we did her surgery like 6 months ago, but she had an all-on-4 done about 8 years ago. But she literally came in with her teeth and the implants all attached. It was in her hands. And so the reason why was there's certain things done with the surgery that could have been prevented and given a longer term solution. So just the whole point of these videos is to bring more awareness to you. Also, it's for so that you know the right questions to ask. All right, so let's continue. Okay, so again, excessive cantilever there. And I just pulled this from the internet. I was looking for a dry screw wall, and they showed this photo. I was like, yeah, I mean, if you got a long screw and you need a place and you got minimal sinuses, we can't do this in your mouth, okay? If we did this, we would completely destroy your jaw. So it's not an option. So this works with, drywall and, sheetrock, but doesn't really work for your mouth. Okay, so now we talked about the upper jaw. That's a major point. Now, the inferior alveolar nerve I was talking about, that's the nerve that gets numbed up when you're doing a lot of dental work down low in your lower jaw. It's the main nerve that innervates your lower teeth. It is present on both sides of your jaw. So this is what it is outlined in purple. And obviously, we do not want to hit your nerves with our dental implants. So, the most time that we talk about your inferior alveolar nerve is when we're doing wisdom teeth, and this patient has wisdom teeth here. So that's what's laying horizontally. But, obviously, we try to stay away from that. But when we're doing dental implants, we try to place your dental implants to steer clear of your inferior alveolar nerve, and we angle your dental implants to stay away from it. And then, that's how you get an ideal outcome. Now, we know that it's when we're doing all-on-4, the bigger issue, what we're always looking at to see like the complexity of an all-on-4 case is going to be the sinuses and how thin your bone is and stuff like that, right?
Yeah.
So lower jaw, yeah, we're always looking at your nerve, but it's not really what's adding to the complexity of like all-on-4 case. We're always looking at the maxilla, the upper jaw, and especially in the previous video you were pointing out also, right? You said you were talking about how the upper jawbone is softer.
Yes.
Right. Mm-hmm. Upper jawbone is softer than the lower jawbone, and that's like drilling into drywall versus the stud, right?
Mm-hmm.
So when we're driving, we're up top, when we're doing all-on-4 up top, it's more complicated because you have softer bone, more porous bone, so it's more like drywall. Plus, you got big sinuses on 60% of the patients, right? And then also you may have like thinner bone too.
Yeah.
Right?
I encountered that a lot.
Right. Mm-hmm. So there's so many factors that make all-on-4 way more complicated up top.
Yes.
Right? So these are some of the things the reasons why we're like talking about all these things. So let's jump to the next point. This is a major important point. So When we were talking about the cantilever, remembering how basically that means how much of your prosthesis or your teeth are hanging off your last dental implant support. So for when you're doing an upper jaw, you're only allowed to have, based off studies, 10 millimeters of cantilever. This is not a hard set rule, but generally this is a rule of thumb. And then for your lower jaw, which has more dense bone, you can have a cantilever up to 25 millimeters when doing a lower all-on-4. But the problem is that everybody's anatomy is different, and this is where the challenge lies, right? So if we're doing an upper all-on-4 on this patient versus this patient, we do want to keep the upper cantilever. If we can avoid a cantilever, great. That's what we're always going to do. But again, sinuses are always going to be the biggest issue. So, but we're going to want to try to maintain that 10 millimeter or one tooth cantilever the most. Meaning, if I'm doing this tooth right here, this is my last tooth, then my last dental implant, I want it to be right here, okay? The tooth in front of it. In this case, we were actually able to get it right at that tooth though, as you can see from underneath. But for a lower jawbone, lowercase mandibular all-on-4, again, you can have a longer cantilever because we have more dense bone on the lower jaw. Now, again, these are rules of thumb. This does not work for everybody.
Correct.
Right? Because everybody's different. Yeah. Again, we talked about the parafunctional habits. How much do you clench or grind? How much force are you putting down? Right? So again, these are not hard, set rules. There needs to be a little variability, but to get the most predictability in the future, it is best to over-engineer, right? Mm-hmm. Whenever possible, can we place additional implants, right? So do we need to pop in some extra pterygoid implants in there? Do we need to do a sinus lift and add another implant, right? These are all options that come on the table.
Or sometimes through the cheekbone.
Right, the zygomatic implants, mm-hmm. right? So patients that have extreme atrophy, meaning bone loss of their jaws. Yes. So those are all options that need to be investigated for patients. So we'll talk more about those in future videos because there's a lot of patients in that boat, unfortunately. So we want patients to be as educated as possible on that. So I believe that's the end of our presentation, right? So yeah, that's pretty much it. So hopefully this information was helpful. Looks like our video is still going, third time's a charm. It's 8:30 at night, I'm exhausted. So we are going to be coming out with more videos. If you guys have any questions, please feel free to leave them below. We actually do read the comments. The only reason why we don't make as many videos as we do is that we're extremely busy practice. But we do want to put as much information out there as possible. That's part of our goal, our mission of our practice here. So again, please help us out with our channel. Please give us a thumbs up if you liked our content. Please give us a follow on our channel. Again, we are going to try to come out with more pertinent information for you guys. So we will see you guys again later on in the future. Thank you.